So this is a 11-year child, Aisha, who is complaining of difficulty in walking, climbing stairs since last few months, and had a history of fever also. So take a focus, got referred from GP for further management. Take a focus history from mother, Alia, from the mother and child.
Okay. Hello, good morning.
Good morning, doctor.
I'm Dr. Hiren, one of the children doctor. Today I'll be taking care of you. Uh, is that okay if I ask you some question regarding Aisha's health concern?
Yes, doctor. Actually, we are here for that only.
Okay. Hello, Aisha. How are you doing?
Yeah, I am good, doctor.
And are you the mom of Aisha, Alia? Can I call you Alia?
Yes, sure, doctor. You can call me Alia.
Okay. Okay. Nice to meet you. Thanks for coming today.
Yes.
So, Alia, can you tell me what brings you in today?
See, doctor, my daughter is suffering from this weakness and she is complaining of pain in her body, all over the body. And she has difficulty in walking also, doctor.
Okay, so, can you tell me since how long this has been going on?
Actually, doctor, this pain started 6 months back. Before that, she was quite okay. And this pain started like she was having difficulty while getting up from sitting position, and then she complained like she cannot climb upstairs. Our high house is on first floor, so she said like she has difficulty in climbing. Then
So, what,
after a few days, again there was neck pain also, and then she complained that she has weakness in lifting heavy objects also. Last 3 months, she is not able to climb up our floor. So we went to GP, and initially he did some investigation, but they were turned out to be normal.
okay, so 6 months ago she was completely all right.
Yes, doctor.
You said she's having a pain and weakness. Is that all the body joints she's having pain or only in the legs?
Actually, not all joints, but she complained pain in the muscles actually. There is no joint
Okay.
pain as such she complains.
Is the
And
muscles of only the legs are paining or
she
all?
has pain and weakness in upper limb, this her upper limb muscle also.
Okay, and if I grade pain 1 to 10, 1 being the least and 10 being the highest.
Yeah,
How would you grade
it
Aisha,
it
your
varies,
pain?
doctor. Sometimes it's mild, sometimes can say like 6 or 7, sometimes 3 or 4. But she definitely had some like disturbance in her body.
Okay. And is it a kind of a sharp pain or what kind of pain, aching kind of
Continuous
pain?
in like aching type of pain, continuous, which is bothering her all the time.
Is there anything which relieves your pain?
The doctor GP prescribed us for some ibuprofen, and when she takes that ibuprofen, she feels better for a few
Anything
hours.
which makes pain worse?
Nothing worse, doctor, but with some activity, she says that her pain gets worse with some activity.
And you said there was a fever also. So could you tell me more about that since how long she was having fever?
Yeah, fever is not continuous, doctor. It comes and goes. Last 6 months, 4 5 times she had fever. Like it was low grade, and usually last 3 4 days. Then it goes with some paracetamol. Then again it comes. But I noticed that when fever comes, she feels more weak.
Okay. And you said you had visited the GP and some investigation were done.
Mm-hmm.
So was that discussed with you? Was there any kind of infection?
See, after going through investigation, GP said there is some muscle problem, That's when the CPK level was high. So he said like we need to see some specialist doctor. That's why he
Mhm.
referred to us here.
And I can see there is a rash also. So, Aisha, since how long you have this rash?
Yeah, doctor, like since muscle, when I started getting this weakness, that time only the rash started appearing, doctor.
Okay, and is it the same or is it a progressing?
Sometimes it's more, sometimes it's less, but you can say it's there all the time.
Is there any itching?
Usually not, it does not itch, doctor.
Okay, and any pain over the rash area?
Sometimes I feel pain in hands, but not like severe, mild only.
And you feel that your problem is progressing, or is it the same, or you feel it's getting worse?
No, no, doctor. I feel that I feel more weak day by day, and I'm really depressed that like whether this pain will like make me wheelchair bound after few days, doctor.
I understand you must be having a little bit difficult time while facing this situation. So, Aisha, do you have any other problem like difficulty in writing or doing any hand task?
Yes, doctor. Yes, I feel like I am not able to keep up with the writing. Writing also also the routine activities also getting difficult. Day to day activities also. I feel like I
Right.
should
So,
like not do anything. Six
is
minutes.
there someone helping you on eating and dressing?
No, it's not need that severe, doctor. I can eat myself, but like lifting heavy objects and like climbing stairs, I have to take support of the railings. That is getting difficult day by day, doctor. 6 minutes
Okay.
done. Huh?
Okay. Is there any swelling on any joint?
Swelling, no, doctor. I didn't never experienced any swelling.
Okay. And how this problem affecting your family life to Alia?
Doctor, I cannot go to school. I cannot participate in the school activities. Missing most of the my friendly activities. My friends call me for playing. I cannot go. Also, I used to help my mother in household work. I cannot do that. I really feel bad about that.
Mhm. And do you have any financial support?
Mm, no, doctor. We are quite well off, so I don't think we need that.
Anybody in the family has the same problem?
No, doctor. As far as I remember, no one suffers like this.
Any hospitalization in the past for the same issue?
Not the same issue, but when she was 5 years old, she had typhoid and she was admitted in the hospital.
And you said currently you are taking paracetamol and ibuprofen. Any other medicine?
Doctor
Uh,
prescribed calcium also.
okay, okay. Any allergy, any reaction to medicine?
No, doctor, not like that, anything.
Any food allergy?
No.
And mom, how you are? Are you coping with this problem?
Doctor, like this, we cannot see our child suffering like this. Our family is like, we are feeling that she has some serious illness, maybe some. I have googled and I found that there is some lupus-like things which comes in mind, and I am really frustrated that it affects kidney and all. So we are really worried.
Mhm. And how about school?
School, actually, she is missing most of the school, but like for us, that is not a priority right now. We just need some treatment for our daughter.
And currently she's able to walk and play, or she needs wheelchair support.
She is able to walk, but like she takes time. Like if she's sitting, it will take her time to move around, and climbing is really difficult. We have to help her getting up to the house.
Are you in any currently with any consultation with different other specialties?
No, Dr. GP has referred to us here, and we are here for your help here.
Okay. Anybody, any other problem she faced when she was small, like during her birth
No,
or
no,
after
Dr.
that?
Everything was fine that time.
How is
I don't remember.
her weight and growth?
Growth
Is
and everything was
she by chance?
fine. No issue, doctor.
Okay. And any problem
5 minutes
with
done. Present your
okay.
file.
Yeah. So today I have taken a history of 11-year-old who has been suffering with the um, difficulty in walking as well as weakness and on and off fever since past 6 months. She has some rash. She was investigated by the general practitioner and CPK enzyme was raised. And currently, she's not able to attend the school fully. She is getting tired, and she's also having difficulty in performing day-to-day tasks. There is no family history of the similar illness, and for family and for the mother also, it is a little bit challenging to cope up with this problem. And there is no history of any past hospitalization, and apart from there, they don't have currently any financial issues. So the main problem is
So, what are the main issues, doctor, here?
main issues are difficulty in walking, getting tired, fatigue, and difficulty in day-to-day activity, weakness, and on and off a fever and a rash.
Okay, so from this history, can you think of any differential diagnosis at this moment?
Yes. Moreover, it looks like probably juvenile dermatomyositis as
Okay,
a first differential, and I would also like to consider other possibilities uh, like juvenile idiopathic arthritis
mm-hmm.
or systemic arthritis, SLE, but the
Okay,
figures
you
are
can
still
proceed.
not very
12 minutes, then
consistent
you
with.
can proceed for examination.
Okay, so um, okay, hello. So I'm going to wash my hand, and I'm going to have a look around. I already introduced, so I'm not going to introduce, but just I will do wash my hand, and I will ask mom whether can I examine Aisha today. Is that okay with you?
Yes,
Is she having any pain at this moment? Aisha, are you comfortable? I'm going to examine your leg and your hands, and which also involve a couple of walking few steps. Is that okay with you?
okay.
And, okay, and after that, I'm looking at the room whether there is any wheelchair, any special shoes, or any support is there or not.
You can see a walking
And
frame there.
walking frame is there. Okay. Okay. After that, I will ask whether there is any pain. Are you comfortable with walking few steps?
Yeah, doctor, I have pain, but I can walk.
Okay. So I will just check for the gait
Mm-hmm.
while she's walking.
Okay.
So what is the gait?
She is like a broad-based waddling type of gait.
Okay. Okay. After that, I will ask her to like walk on the tiptoes and walk on the heel.
Yeah,
She's able to do.
you can see obviously that she is like having waddling type of gait.
Okay. Now, I will also just would like to check her back, whether
Mm-hmm.
there is any problem in the spine is there or not.
No, no, there is no problem.
Okay. Now I will ask the Aisha. Aisha, can you please sleeve up your trousers slightly? And I will step back and will have a look. I will make a first a general examination of the head and face. I can see there are rashes.
Mm.
I will make sure how is the weight, how is the growth. Is it
Little
uh,
bit averagely built.
weight and height looks below average?
Average build.
Average, okay. And is there any other dysmorphic features are there or not?
No dysmorphic.
Okay, and we'll talk to the Aisha, we'll check her mentality and the speech function she's talking to nicely or not.
Yeah, she is
And
okay.
okay, uh, after that, uh, so I would just clarify with the examiner, is it the neurological or musculoskeletal? Because it's a mixed. So
Yeah,
uh,
you can go ahead
can
with
I be
muscular.
the musculoskeletal examination?
You examine the motor system of the child.
Okay, okay. So I will just explain like now, Aisha, I'm going to please lie down on the bed. I'm going to move your legs and I'm going to assess the tone. Keep your leg floppy. We'll just make a passive movement. Just before that, I will ask, is it painful? She says no, then I will check the tone by rolling it and by lifting at the level of knee joint. And how is the tone? I will check in the
Uh,
both the legs, right,
it
left,
is
both.
a little reduced, but you find some like muscle bulk is reduced.
Okay. And also, I will have a look whether there is any rash on the both the leg area, on the tibial sheen, and any fasciculation, any wasting, visible wasting is there or not.
The muscle bulk is reduced more, like thighs muscle bulk is little bit reduced.
Then I will also check the tone at the level of ankle
Mm-hmm.
in both the side.
Okay.
Tone is okay.
All over tone is a little bit reduced, but not markedly reduced.
Okay. Then I will also look for the like evidence of any contracture or any scar is there or not in the both in the back side and in the ankle and all the areas. No contracture, no scar,
No,
right?
no. You go and I'll interrupt whenever possible.
Okay. Now I'm going to check the power. Aisha, can you please raise your leg and don't let me push it down. I will check at both the leg at the level of hip first. I will check first whether she's able to do
Mm.
uh, against the resistance extension. Then I will check her to press my hand below against the resistance. I will check the flexor group power, flexor extension, and then I will also check in the abductors and adductors.
Mm-hmm.
So power in both legs,
Uh,
reduce, decrease,
it, it's grade 3 at the hip.
grade 3. Okay. Then I will check the, I will ask her to bend the knees at the 90 degrees and I will ask her to push my hand against the resistance and then again I will ask her to don't let me uh, pull her leg and
Okay.
then we'll check the power at both at the level of knee joint.
It's grade 4.
Okay, then I will check at the level of ankle. Please push the your foot same like pedaling the gas
Down
pedal of
gas
the
pedal.
car. Okay, then I will check the now I'm going to tap uh, with this hammer. If it hurts, tell me. I will stop it and we will look for the reflexes, whether it's increase or decrease.
See, reflexes are little bit difficult to elicit.
Reflexes are difficult to elicit. Okay, so then I will also check for the Babinski.
Okay. Babin's is flexor.
Babinski is flexor.
Flexor. Normal.
Normal. Okay. Okay. Fine. Now I would like to check the upper limb. Uh, I will check in the upper limb the power. I will ask him to make the chicken wing with the both shoulders, and I will check the power against resistance, flexure extension group,
That's around grade
abductor.
4 at shoulder.
Grade, grade what?
Grade 4.
Grade 4. Then I will ask her to make like a boxing posture, and I will ask to uh, pull my hand and push my hand against the resistance
Yeah, around grade 4. So
on
20
grade 4.
minutes done, you can present your finding, doctor.
Okay, so I have examined motor neurological system of 11-year-old child. She has a rash. She has a difficulty in walking. She demonstrated a waddling kind of gait, and on neurological examination, um, her tone in both the legs slightly reduced, and she has a power grade 3 in both the hip as well as grade 4 at the level of leg and ankle, and she has a reduced reflexes at knee, but normal planters. In upper limb also she has power grade 4. Uh, Considering the uh, waddling gait, skin rashes, and from the history, I would like to consider probable my provisional diagnosis as a juvenile dermatomyositis. However, to
Mm-hmm.
complete my examination, I would like to do full musculoskeletal examination, examination of the eye,
Mm-hmm.
and a full skin examination also.
So why do you want to examine the eye?
Uh, the the picture looks like a juvenile dermatomyositis, but in JIA and the some arthritis like oligoarthritis, there is the uveitis.
Mm-hmm.
Here it is
Okay.
not there, but I would just like
So
to put for the
what other
vision.
close differential you can think of in this child?
This child, first juvenile dermatomyositis, second is uh, JIA, third is
There is no joint pain, joint swelling.
yeah, there is no joint swelling, but in the early stage could be. And I would also like to consider another proximal myopathies like
Mm-hmm.
Duchenne muscular dystrophy, but she's a female, and so it is less likely. There is no calf hypertrophy,
So
and other proximal
so
like limb girdle. Yeah.
what will we do for further investigations?
So for further investigation, I would like to do the routine investigation like complete blood count, inflammatory markers like CRP and rheumatoid factors and ESR. Also, I would like to do creatinine phosphokinase again, and um,
Mm-hmm. Okay.
yeah, that's all.
What is the diagnostic test here? It
It's
considering
a clinical
JDM
diagnosis,
diagnostic
and
test of
it's
JDM.
a clinical. I think it's a clinical diagnosis.
Mhm. So how will you manage this child?
Uh, I would like to involve the multidisciplinary team, which
Okay.
includes the physiotherapist, occupational therapist to help her in the day-to-day activity, as well as the rheumatologist and the pediatrician.
Okay. So what medicine will you give?
Um, Medicine, first of all, the painkiller medicine. starting with the paracetamol. If it is not getting controlled, can take help of the NSAID group of the medicine like naproxen and the brufen.
That she is already taking.
Yeah, and some physiotherapy probably can be helpful to alleviate the pain.
Okay. Time finished. Okay.
Okay.
So how was the feeling? Surprise feeling?
uh, Surprise you. I was like thinking I mean it's a pure MSK case, but to make it a neuro, so
Hmm.
something yeah, a little bit.
Different, like but in mixture
It's
actually.
a mixture, yeah, yeah.
It's a
It's a
mixture.
mixture. It can be
So
both.
regarding feedback, history, huh? So
Hmm.
history was like muscle pain and weakness. So you
Hmm.
did quite well, like you any elicited onset, duration, progress, and treatment history you took quite okay. Investigation also. Uh, Additional history like rash history was there. So rash history also you asked, but you did not ask like where it started, how it progressed, or what all areas. Because you said like, I can see the rash there, but you are taking history. You are not supposed to examine and comment.
But it's given in the queue, no?
But that is for like your understanding, rash
Hmm.
progression and distribution, like where the rash started, how it progressed, and where are the water places. Maybe I'm wrong. Like the Q we can use that in the history. That's fine. Additionally, like you asked like joint pain history. That's good. Close differential here is SLE. So hematuria you could have asked hematuria involvement and. Again this what do you call complication history like carpal tunnel syndrome is complication of the juvenile dermatitis. Regarding that also we could have asked. Otherwise overall you asked regarding family history and impact on the disease and child. There was not much chronic thing to it. Was not like past history was much significant. Any recurrent respiratory illnesses, infections, like that is also one of the complications. Like JDM patient has recurrent respiratory complications, respiratory infections. That also we could have asked. Regarding his presentation, you summarized it nicely. Then in examination, when the child had like you suspected proximal myopathy, then I feel like Gower sign could have been done. What do you feel? Hello, hello. Am I audible?
Yeah, go. Yeah, yeah, you are audible.
Yeah.
I did not do because like is
So
a
at least you could have mentioned like if it's okay, I will ask the child to do our sign, or at least ping
hmm.
our sign you could have done.
Okay. Mm-hmm.
Our sign. Rest of the examination went smooth. The like tone, power, reflexes you elicited. Then regarding again presentation, again you summarized quite well. This differential diagnosis like SLE could have been mentioned, like close differential.
Mm-hmm.
JIA, other proximal myopathies because child had proximal myopathy. Examination, you did not mention like rash over the eyelids and face, like the butterfly type of rash. A typical heliotrope type of rash was there, violaceous rash. Also, you did
Mm-hmm.
not mention the Groton papal rash on the hands in the examination.
Okay. Mm-hmm.
Then, lastly, management wise, like steroids. Steroid is the main management. Prednisolone. We have to control the inflammation of
Mm-hmm.
muscle. And in diagnostic test, either muscle biopsy or MRI.
MRI for what?
Muscle MRI for diagnosis of juvenile dermatomyositis. That is either biopsy or MRI.
I was not sure
Okay,
about
so
that.
MRI visit.
So
Yes, I read that. CPK is for this diagnosis of muscle inflammation, but diagnostic is muscle biopsy and MRI,
In
either of the two tests.
MRI, we see muscle inflammation.
Yeah, muscle inflammation and biopsy you can
But
see.
how can be that diagnostic? Inflammation you can
Like with
have in
clinical
other condition.
presentation, with clinical presentation and these muscle inflammation that adds to the diagnosis.
Mhm. So it is a diagnostic. Huh?
Hmm.
Diagnostic.
It is
Yeah,
diagnosed medically, but test if you want to diagnose through some investigation.
we can put like this. A new addition in dermatomyositis
Voice is not clear,
diagnosis.
doctor. Hello.
There is, to be honest, no specific diagnostic test. You can put forward it like this. Hello,
Ah, yes, yes.
Yes, Dr. Tahir. Yeah.
I'm audible.
Yes,
Yes.
yes.
Okay, as I said, the MRI, it's a new entity which they have entered in the diagnosis of dermatomyositis. To be honest, as Dr. Hiran said, there is no actual diagnostic specific test. It
Mm-hmm.
is a clinical diagnosis, but there are labs which can support the diagnosis.
Okay.
And MRI is not diagnostic. You should say it's a radiological diagnostic, because in radiology it is diagnostic, but there are other tests as well.
Right.
So it can give you muscle inflammation, and it can show the calcifications in the muscles. It can show you abnormal signals, and these abnormal signals they are picked by the radiologist, and they are diagnostic for dermatomyositis. But there are other tests like ANA antibodies, like antibodies test, biopsy, as he said, and other tests like anti-Jo antibodies, and there are a lot of antibodies uh, are there in the text.
Yes, you said correct. On the contrary, better to mention X-ray to see calcified nodules rather than MRI. What you say? There is a calcification nodule happens no in this condition.
Yeah, there are actually subcutaneous or calcifications. I
Yes.
have seen two cases, and both of them unluckily from Afghanistan, because I'm near to the border with Afghanistan, and it was diagnosed specifically on X-ray, because she came with pain in her limbs, and we didn't know that it will come out to be dermatomyositis. Although when we got that calcification, then we look into the detail, and we saw that guttural papule, and we saw that rash and everything. But initially, because it's an uncommon condition, so sometimes you may miss it in the clinic, in a busy clinic.
Right.
Okay.
Also,
That
EMG
is
is also
supportive.
important.
EMG.
EMG would also support the diagnosis. EMG
Yes.
and another
And
kind
skin biopsy. Sorry. Yeah, go ahead, please.
see,
Yes.
Okay.
Yes.
So anybody else want to give feedback?
Skin biopsy is equally important to muscle biopsy in dermatomyositis. First, you try to do skin biopsy, then second choice is muscle biopsy.
Actually,
So what we see in the skin biopsy?
Skin biopsy, same thing, inflammation and some histological changes similar to dermatomyositis. Right.
Right.
In fact, out of all these tests, skin biopsy is the most confirmatory comparatively, as compared to autoantibodies or you do EMG, MRI, whatever, or muscle biopsies. First choice will be skin biopsy. If skin biopsy will confirm, then no need to go for the muscle biopsy or blah blah blah.
just let me
So
check about muscle biopsy.
clinical plus that, and that Dr. Tahir said the calcified nodules were there. So they sometimes what happens, the patient is already on treatment, like he is taking steroids, so rashes will not be there. You won't find the rashes, only calcified nodules will be there in the patient, so that can also be there. So not necessarily you will find the case of dermatitis with heliotrop rash or Cotras papule clear.
See, like in Mark BT, they have mentioned
Right.
diagnosis is confirmed by muscle biopsy.
Yes, but I had
Mm-hmm.
seen other literature where it is skin biopsy, maybe latest edition skin biopsy. Mark
So
BT
what they
little
In
have
old,
fact,
mentioned,
so that cannot
so
be.
what I was
what they have
remembering
mentioned,
was
MRI
skin
will detect
biopsy.
muscle inflammation and diagnosis confirmed by muscle biopsy.
I send you one from the Mayo Clinic skin website. I'm sending in the group. I mean on the Zoom. Uh,
Okay.
where it is chat. Uh, see this. Read this.
I had a same feeling of skin biopsy, this thing, but then I was not sure about this.
See, this is written on the Mayo Clinic website. Skin or muscle biopsy. A small piece of skin or muscle is removed for laboratory analysis. A skin sample can help confirm the diagnosis of dermatomyositis. A muscle biopsy might reveal inflammation in your muscles or other problems such as damage or infection. If the skin biopsy confirms diagnosis, a muscle biopsy might not be necessary.
Mm-hmm.
Okay. But it overall it was good. Yeah, I think you apart from this cotton gover sign, huh? You should have checked gover sign. Apart from that, everything is good. I think swallowing is also very important in complications of dermatitis. Swallowing difficulty is too much in such patients.
Mm-hmm.
So because of that
Mm-hmm.
they will get malnutrition and weight loss and everything. Mm. So swelling is the first or foremost difficulty such patients face in day-to-day life. So that
Mm-hmm.
I think should be added. Swallowing, you should ask the patient. Number two, Gower sign because this we consider is lower motor neuron type of this. So Gower sign, these two things. Otherwise, every all are good.
Okay.
One point is, in addition to this GI manifestation, the most potential complication is the GI hemorrhage. No? That is also important. We should also ask for this throwing up, weight loss, and loss of appetite, as the Dr. Pankaj told, due to the swallowing in. So these things we need to mention
Mm.
systemic inquiry.
Uh, I think I asked weight and growth.
Yes, that you ask. But throwing up
Mm-hmm.
and also this sometimes bleeding, also to rule out this SCL, but this is also vasculitis process. So GI complications are more common as compared to the respiratory or cardiac.
Mm-hmm. So bleeding may happen. That's what you mean to say, right? GI hemorrhage.
Yes, yes. Intestinal, yes, bleeding, yes.
Okay, chalo. Anybody else want to add anything, or we'll move to next?
Hello.
Yes, yes, doctor.
Yeah. Uh, I think Dr. Harin did well, but I think in the history, in any disease affecting the muscle, you have to involve the skin, the hair, the nail, and I mean any skin rash. Okay, for the hair fall or nail changes, it's noticed or not, and is there any change? So if you think about the SLA, you have to change if there is any change in the vision, any eye redness. If you have to want to exclude the other differential. And here in the dermatomyositis, the mother said that the disease is progressive. When the disease is progressive and when there is a flare up, the swallowing affected, so they got shocking every now and then pneumonia cause of aspiration, and sometimes they got respiratory failure because of the lung affected because of the disease flare up. So you have to exclude that in your history.
Mm-hmm. Okay. Right. So I think vision I asked and the rash I asked, but hair fall and nail also I should include. Yes.
Yes, good point.
Mm.
So that will also like help to distinguish it from SLE. But
I'll just add one or two more things. Maybe it help.
Mhm.
The I don't know this Nelson is a textbook in UK or not, but it's the criteria which has developed by them in 21st edition, and they say it's a very simple criteria that classical rash plus three of the following: uh, weakness, muscle enzyme elevation, more than one, yani more than one enzyme elevation, and EMG changes and muscle biopsy. Out of these four, three plus classical rash is a diagnostic criteria for juvenile dermatomyositis.
yes, sir.
And the skin biopsy is not mentioned here. They say that on top, previously MRI was not on top, but now they keep MRI on top. If it is not diagnosed, then followed by biopsy, and MRI followed by EMG. If not diagnosed with these two, then followed by biopsy of the muscle. That's all.
Yes.
Yeah, good. Very nice point. Yeah.
Okay. Can you share that page, Dr. Tahir, in the group? Photo and
Yeah, sure. I'm sending you.
yeah. Okay. Thank you. So there is no message from the Zoom that your time is